Welcome back. Welcome back. Your man, Dominic K, in here. Dominic K in the morning on the all-new radioonfire.com. Thank you for joining me. Of course, my birthday was yesterday. So I definitely want to thank folks that took time to wish me a happy birthday. A lot of love. Got a lot of love out there yesterday, and I really appreciate that. So we are back for another season of Dominic K in the morning. And today, so much to talk about. And I feel like there is always like this never-ending stream of news and things to get into. Of course, Dominic K in the morning is sponsored by Tasty Moscato. If you could pour sexy in a glass, this would be it. This smooth, seductive Moscato wine blended with vanilla takes your palate to a whole nother level of taste meat. Unlike most, Tasty Moscato can be deliciously paired with a variety of meats, cheeses, veggies, as well as desserts. It's the sweet taste of luxury that you've been craving. Tasty Moscato. So, of course, here on the program, we deliver the biggest political and trending news stories of the day. Regional reporting from Atlanta and Baltimore. Show us fun, show us upbeat, but I also want to expose what's really happening in this country. And there's a whole lot going on. New episodes of the program dropping 8 a.m. Don't want you to miss any of our live broadcasts throughout the day. We drop content as news happens. And, of course, we rebroadcast the morning program throughout the day. So COVID-19 is spreading even more than it already was. The hyper contagious Delta variant of coronavirus continues its movement around the country. So more and more businesses and government agencies are pushing policy changes to mandate vaccinations against the virus. So whether you're somebody who's on the board with taking the vaccine, or you're somebody who's not taking the vaccine, or you're on the fence, or whatever it is, I don't think that we can dispute the fact that coronavirus is a problem. It is a major problem, and it's something that is affecting everyone in the world. Everyone in the world. So what can we do? What can we do to stop this? How do we combat this? So this latest, flurry of changes arrived over the past week, and a lot of Americans are going to feel the result of these changes that are happening. Basic employment obligations, recreational activities, like even going to the gym or going on cruise ships. All these things are being affected by the changes that seem to be coming. So we have vaccines that are out there, a couple vaccines on the market. Well, I don't even want to say on the market because they are emergency use only. Now, folks who are trying to get people to take the vaccine seem to attempt to diminish the significance of FDA approval. They'll say, oh, it's not that much of a difference. It doesn't mean that much. Like they try to diminish it because they really want you to take the vaccine. And my thing is this. If you want somebody to take the vaccine, you cannot talk down to them. You cannot trivialize their questions or try to minimize what their concerns are. If you're trying to get somebody to take the vaccine, right? You cannot, because you're somewhere and you've gotten to a point, you can't insult somebody into changing their minds. People know about coronavirus. People understand that it is a serious thing. Now, the question comes in, and the question is, what are you going to do to combat coronavirus? What in your mind are you going to do? We're still learning about this. Everybody doesn't know everything about this. Right? They're still learning. A lot of the recommendations that have been going around from CDC, from the WHO, from the government, your local, federal, whatever, has changed over time. Dr. Fauci's changed different things that he's saying and other doctors, because we are still learning about this virus. We're still learning. So something that they said 6 months ago, now that they have more information, they're saying something different. There was a time when they were saying, oh no, kids, this is not something that affects kids. This is only something that affects seniors. That's what they were saying. And then over time, you see that it is affecting everybody. It is affecting everybody. So some people say that because of that information, because of the fact that the recommendations are constantly changing, that we don't have to listen. We shouldn't listen because this could change again. And it could very well change again. It very could change again. And so, of course, Diamond K in the morning, the all-new radioonfire.com. So last week, New York City announced that it would be the first city to require a proof of vaccination for a range of activities, including indoor dining, concerts, and gyms. That's what New York is doing. In a memo released earlier this week, Monday, Secretary of Defense Lloyd Austin said he would ask President Biden to approve a plan to require COVID-19 vaccination for all members of the U.S. military by mid-September. Biden indicated he supports this plan. Here's the thing. Without FDA approval, they ain't going to mandate nothing. Right? How are you going to mandate something that's only for emergency use? So what that means is that emergency use is going to come to an end, and this is going to get full approval, and it's going to get full approval pretty soon, because they're not going to. This is the funny thing that that's happening here. So when this group of vaccines came to be, right, they talked about the fact that 9 months. They came up with this, and the rollout was historic. It normally takes years and years, and that is true. It normally takes years and years. But they got this in what they are calling record time. You got different things that you want to be rushed, right? Cooking up your food, not necessarily, and your vaccine, not necessarily something that you want to rush. But nevertheless, the need was something that they wanted something as quickly as possible, and they got that, right? So then they want all of the benefits of it being something that was developed over time. And what is the benefit of taking your time? Obviously, you have a chance to view data. Obviously, you have a chance to see the effects. Obviously, you have a chance to tweak things and really have a real time reaction, potential reactions. But when you do something quickly, you do this within 9 months, then they also, supporters of the vaccine, want to point to and say, oh, well, you take vaccines when you go to school. You take vaccines for all these different things. Folks in the military have to take all these vaccines. But yes, those vaccines were developed over time, years and years. This vaccine was developed within 9 months. So you're not going to get the same benefits. People are not going to have the same level of trust for a vaccine that was created in 9 months. And then you want to use as the example the fact that you have all of these vaccines that folks take that have been developed over the course of years. So in order to convince folks to take this vaccine, you cannot talk down to them. You cannot disrespect them. You cannot belittle their thoughts and concerns. Some folks say vaccine, government say vaccine, I take vaccine. Some folks are like that. Other folks have more questions, right? Other folks need more reassurances, right? Emergency use authorization, often called an EUA, it's gotten plenty of attention during the COVID-19 pandemic. Obviously, the concept of the Food and Drug Association, FDA, authorizing a product or treatment quickly and without going through the full and complete review process, was first introduced in 2005. So this is a relatively new thing. 2005. So when you talk about emergency use authorization and then you have full approval, what are the implications? What does this mean? Obviously, the attention on this phrase has happened and it has exploded, and you hear it all the time. So back in 2005, the FDA issued an emergency use authorization for an anthrax vaccine available to military personnel due to a anthrax-laced letters that killed or sickened nearly a dozen people. So they wanted to put something out there quickly, and that is what they did. Now, over the years, emergency use authorizations were issued for a variety of experimental therapies for diseases. The H1N1, often called the swine flu. There was the Middle East Respiratory Syndrome, MERS, Ebola, Zika, which often arose quickly and threatened to become bona fide pandemics. So they issued these emergency use authorizations. Now, since last year, this pandemic, a number of emergency use authorizations have been issued for COVID-19 related products, including the antibody test, the clinical treatments, and the vaccines. But what does it actually mean when a product is given the EUA? And why don't companies automatically seek the full FDA approval off the bat? There is a lot of reasons. There are a lot of reasons. Companies having full approval provides a measure of control. The FDA can withdraw emergency use authorization at any time. And you saw them do that with Johnson & Johnson. This prevents the company from selling or dispensing the product. In contrast, it can take several years for the agency to rescind an approval once they give it. So typically, insurance does not pay for products under emergency use authorizations. Although in the case of COVID-19, the vaccines, the government is paying for this and possibly making financial motives less of a factor for the companies because they're still getting paid. And if they were not getting paid by the government, this would be a whole nother thing. So the lack of full approval by the FDA has been cited as a factor in the hesitation of some people to get the COVID-19 vaccine. And it makes sense, right? It makes sense. I don't understand why folks that are pushing the vaccine don't understand why, for some people, FDA approval means something. I mean, yeah, everything has been torn down in this country due to the last presidency. A lot of our norms, a lot of our agencies have their credibility been deteriorating by the minute. And so FDA approval doesn't mean what it used to mean. And the FDA is definitely not perfect by no means. But typically mandates come after years of experience with the vaccine. And for some reason, you have folks who are doctors, who are so-called educated people, getting on media outlets and say that FDA approval is not a big deal, right? It normally takes years for the approval. It normally takes years for the vaccine. This is usually part of the process. And they just throw it to the wayside and act like it's not a big deal when it really is. Just tuning in, Dominic in the morning on the all-new radioonfire.com. Of course, we are talking about masking. We're talking about COVID-19. We are talking about EUAs. versus full approval. And of course, we're talking about the vaccine. Here in the program, we deliver the biggest political and trending news stories of the day. And Dominic in the morning on the all-new Radio on Fire. We are available on the WRF Radio app. Simply download WRF Radio in your app store. Leave me a comment. You can scroll your timeline, attend a Zoom meeting on mute, do some shopping, send an email, all while listening to Diamond K in the morning. And Diamond K in the morning is sponsored by Flyers on Fire. If you need a flyer created, Flyers on Fire can design your quality digital flyer in 24 hours. Are you promoting something on social media? Flyers on Fire can help you brand your message with a quality flyer. Visit us on Instagram at Flyers on Fire. So, of course, you can get breaking news and adult conversations covering topics that are important to the Black culture and the world. Visit radioonfire.com for our original radio podcast and TV programs. So, vaccine mandates, I feel it coming. I also feel full approval coming. And I'm not, I'm not too excited that they're going to rush full approval, because this is supposed to be something that comes with time and time to, look at the data. You hear people talk about the science. We're followed by science. They're followed by science. Many of these folks failed science class clearly. They just throw the word science around. But what we're talking about, COVID-19 vaccines are going to be required for the military under this new U.S. plan. It's coming. The Defense Secretary Austin said that I will seek the president's approval. He's going to seek the president's approval to make the vaccines mandatory no later than mid-September or immediately upon the FDA's approval, whichever comes first. Austin said in his memo, warning them to prepare for the requirement. So that is coming. Pentagon plans to provide time for the FDA to give a final approval to the Pfizer vaccine, which is expected early next month. Without that formal approval, Austin needs a waiver from Biden to make the shots mandatory, and Biden has already made clear that he supports it. I just want to say this. We have so many drugs on the market or previously on the market that had FDA approval that years later we found out had a negative effect on patients. And there's class action lawsuits and all those type of things. So I hope that all of this is being thought of. They're going to probably come up with some kind of cloak to protect them if it turns up that these vaccines have hurt folks. They're going to probably find some way to protect themselves, the COVID-19 restriction waiver or some other kind of crap that's going to happen. But I hope that this is really being thought about. I hope, because if it turns out that they give vaccines full approval, FDA approval, and it turns out that it hurts people down the line, the credibility of the FDA is going to be next to nothing. So I hope that this is something that is really considered. The FDA already has approved things in our food that hurt us, cause cancer and other stuff. So, I mean, the FDA to me is already on shaky grounds anyway. They approve things that are not meat and approve all types of steroids in our food. This is the same agency, and we're looking for them to be the saviors. Help us all. God help us all. According to the Pentagon, more than 1 million troops are fully vaccinated, and another 237,000 have received one shot, according to the Pentagon. But the military services vary widely in their vaccination rates. Navy said that more than 74% of all active duty and reserve sailors have been vaccinated with at least one shot. The Air Force said that more than 65% of its active duty and 60% of its reserve forces are at least partially vaccinated, so they have one shot. And a number of the Army appears to be in the 40% range. So some unvaccinated troops have said that they'd get the shot once it's required, but others are flatly opposed. I just don't see how, with good faith, they could do this to our men and women. I don't. And I understand it comes from a good place. Like, you want to stop the virus, you want to help do things. But now let's look at this vaccine. The vaccine does not prevent you from getting COVID-19. But they're going to say, no vaccine is 100%. Right, that's true. But you're saying to take this to stop the spread when you can still get COVID-19, you can still spread it, you can still die or be hospitalized. All these things can still happen. So when the president says this is a pandemic of the unvaccinated, that's not true. This is a pandemic of the misinformed. Now, understand this. A big part of the reason that we have the spread that's going on right now is because there was a big push for folks to get vaccinated. Many folks got vaccinated, and then recommendations came down that said, take your mask off, do everything that you were doing before. They stopped pushing social distancing with folks that were vaccinated. And then it turned out that folks that were vaccinated could still spread the virus. There were many folks spreading the virus, vaccinated and unvaccinated, because some of the unvaccinated folks, they started wilding out too, because the directives came down to tell people to take the mask off. Why? I don't know, right? They didn't have evidence to back it up. They always say, science, we're doing this by science. No, you're not, because science is data, and you don't have enough data for a vaccine that was created in 9 months. You don't have enough data yet. So when they start talking this science, they're throwing the word science around. They failed science class, because science is data. If you don't have the data, it's incomplete, right? It's incomplete. You don't have the evidence yet. The same reason that they were saying last year that it wasn't going to affect kids, and it does. It does affect kids. It does affect kids. That's why people need to wear a mask. You need to wear a mask. It's very simple. And then you have the people that are saying their freedoms are being violated, right? That's a bunch of crap. The mask is something that's going to prevent you from breathing in some of the airborne stuff. Not only coronavirus, just a regular cold, just a regular flu. Since we've been distancing and masks have been introduced into our, everyday lives, many folks are more healthy because they haven't been breathing in, and you're being more aware of what you're breathing in, how close you're getting to folks. I haven't had a cold, knock on wood, or the flu since any of this stuff happened, because of masking, because of more hand washing, because of more social distancing, and just being more careful. That's not a bad thing. I personally want to continue to wear a mask because it's not only protecting me from coronavirus, but it's protecting me from other things that this is in the atmosphere. Now, of course, it's not going to stop everything, right? But it has. I have seen over time. Talk about science. You talk about data. Me personally, me and my family wearing a mask, being more socially distant, has prevented some basic illnesses like the cold and the flu, and also coronavirus, right? Now, if you are vaccinated and you're wearing your mask, that is a good thing, because you can still spread. And here's the worst thing about the asymptomatic thing. vaccinated folks can still spread coronavirus and not have any symptoms. So you're walking around vaccinated thinking that you're all good, and maybe you are, right? But you can still spread it, have it, and not have any symptoms. That's a bad thing. That's another reason why we have this variant floating around. It's not just vaccinated folks. It's not just unvaccinated folks. It is everybody. It is everybody. And until we have more information, we're not going to be able to fully defeat this. I don't want people to live with, I want this eradicated. This needs to go away, right? This needs to go away. But in order for us to get there, it's going to take time. And we need folks to mask up indoors. We are going into the fall, then the winter. You're going to have regular colds. You're going to have flu. You're going to have coronavirus. You're going to have all these things that are going around. And it is going to be a disaster. Wearing a mask, bare minimum. I mean, let's go back to the president. They were calling the president out after the vaccination. You're already vaccinated. Why are you wearing a mask? And then he started buckling to the pressure and he stopped wearing a mask. Now they're back to wearing a mask. And we need to stay there. I'm glad that they're back to wearing a mask in many instances. Now, if you don't want to get the vaccination, can they make you get the vaccination? Can they make you? I don't see how. I don't see how they can make you. They can put pressure on you, definitely. You talk about Lamar Jackson. Lamar Jackson from the Baltimore Ravens has had COVID-19 twice. He tested positive again, missed the beginning of training camp. And while he was away, Josh Allen, another quarterback from Jackson's class, signed his big extension. And it's really raised more questions about how Jackson's negotiations are going with the Ravens. Jackson is practicing again, trying to make up for lost time while adjusting to some important new teammates. Jackson spoke to the media for the first time on Monday since returning from COVID-19, the COVID-19 list. He began practicing over the weekend, and his positive COVID-19 test came right before the start of training camp. And he also tested positive last season and missed one game. So some folks are looking crazy, like, why won't he take the vaccine after he's got COVID twice? Now, here's the thing. He could have still gotten COVID twice with the vaccine. We talk about the Texas Democrats who are all vaccinated, all on the plane without a mask on, and then a gang of them gets COVID-19. Several senators who are vaccinated, COVID-19, right? So just when they say they're flabbergasted as to why he's not getting the vaccine, he's not 100% sure about getting the vaccine because vaccinated or not, he can still get it twice. You know, last year, the doofus former president was saying he was immune because he had COVID-19 once and he was immune, right? Now we have more information and that's not true. So it doesn't matter who's saying it. You're just making these wild assumptions and something could be not true. They thought that because you had COVID once, you only want to get it one time and you built up some type of, and that was crap. That was crap. Lamar Jackson's had it twice and could have it again, get it again. We don't know. Could get it again. So it is something that is still going to happen. You're going to have a lot of folks that are not going to want to get vaccinated. You're going to have a lot of folks that are going to want to get vaccinated. But I don't think the way to go is to insult folks into doing anything. It's negotiations. That's just not how you do it, right? The vaccine does not stop you from getting COVID-19. And it is a big reason why folks are on the fence about getting it. It's a big reason. It does not stop you from getting it. So they'll say, well, it minimizes your reactions. I have seen and heard of and know plenty of folks who are vaccinated and still hospitalized. They don't like to talk about it. The media, the mainstream media, but it still happens. And that's understandable because one, you developed this in 9 months, so you still got to tweak it. They still don't have it down pat yet. But it is something that's going to take time. So indoors, especially going into this fall, we need folks to mask up indoors. We do. That's vaccinated or unvaccinated. This is not approved for kids yet, folks, young ones under 12 years old, so they can still spread it. They can still get it. They're going to go to school. I mean, they spread the cold around, the common cold. You think that they're not going to spread COVID-19? Are you kidding me? Of course it's going to happen. Teachers, and you can't force the teachers to get vaccinated. You can't force them. I mean, you can't. How are you going to do that? How are you going to do that? But we don't want this to spread, and we don't necessarily want kids to be remote either. So there's a very simple solution. It's called wearing a mask. It's not about their freedom. It's not about their freedom. They got to wear a shirt. They got to wear pants, bottom skirt. They got to wear something. They got to wear clothes. Is that violating their freedom? No, it's not. But you still got folks that are just talking about anything, any type of rule that is laid out. You got folks that want to go the other way automatically. Not sure why. HK on YouTube says it's amazing that they're playing upon the cognitive dissonance of people's minds, saying the vaccine prevents the spread. The vaccine does not prevent the spread, as you know, HK, and they are absolutely playing on that. I wish that they weren't doing that, because here's the thing. The only thing that the vaccine does, allegedly, is stop you from getting as sick as you could. That's it. Okay, that's it. And maybe you get a sticker. Okay, but it doesn't stop you from getting it. It doesn't stop you from spreading it. I don't really know too much what it does. And over time, the efficacy, they like that. That's a new word they put out there. The efficacy is decreasing by the minute. Okay, so they're going to have to do booster shots because this is something new. It's not that potent. If you got to give somebody 2 shots within 2 weeks, it ain't that potent. And if less than a year, the efficacy is going down and down and down, it's not that potent. It's not that effective. It's not that effective. So they're going to continue to try to give you more shots. Now, here's the other thing. The drug manufacturers have been talking about booster shots for a while now. And you got to look at that sideways too, because let's keep in mind, these booster shots are more money for the drug manufacturers, guaranteed money because the government's paying for it, right? If they approve booster shots, that's more money for the drug manufacturers. And we're talking about this, the government is footing the bill. The government's going to come up with whatever the money. So if the drug manufacturers say, yep, we need a booster shot, that's more money. And ever so often we need booster shots, and that's more money, it's more money. There's so much that we have to look at and we have to really take in during this whole process. So CDC, another agency that has really had their credibility damaged during this pandemic. CDC urges COVID-19 vaccines during pregnancy as the Delta variant surges. So, of course, there was a time when they were talking about pregnant women. No, now they're saying pregnant women take it. Now, this is where you're going to get into that fuzzy area. You start having pregnant women having problems with their fetus after taking these vaccinations, and all hell is going to break loose. Once again, I hope that they know what they're talking about with regards to this. Centers for Disease Control and Prevention urged all pregnant women, this is today, have urged all pregnant women to get the COVID-19 vaccine as hospitals and hotspots around the U.S. see disturbing numbers of unvaccinated mothers to be seriously ill with the virus. It just is another thing that's so confusing. But I guess when you come up with something within 9 months, you haven't thought about anything. Why is it that if somebody gets COVID-19, you can't give them a shot and they get better. That's what they need to be working on, right? Not some convoluted thing, because everything is not some convoluted thing that minimizes their symptoms and gets them, because if they eradicate this thing, then all the money that they can get on the treatment goes out the window. Goes out the window. They keep saying this. CDC says the vaccines are safe and effective. It has never been more urgent to increase vaccinations as we face the highly transmissible Delta variant and see severe outcomes from COVID-19. The vaccine is not effective against the Delta variant, and it's more likely that the vaccines are not going to be effective against any future variants, because this is the other thing that's very dangerous. As the virus continues to spread, it presents more opportunity for mutation and stronger variants of COVID-19. And as the mutation continues, the vaccines that were created in the past are going to be like an old, Nintendo 64 video game in one of these new systems. It's not going to be compatible. It's going to be some old stuff, and now we want that new variant. But the CDC's advice echoes recent recommendations from other doctors, top doctors around the country. The agency has previously encouraged pregnant women to consider vaccination, but had stopped short of a full recommendation. Now they're saying, get it. And as I said, things just continue to change. 1 minute we do this, 1 minute you do that. And that's something that happens when you're dealing with a new, a new virus. This is new to us. We never had to experience anything like this in our lifetime. And I am just hoping that we get to a point where we're on the other side of this. But going into the fall, going into the winter, who knows? Lord knows what we are in store for. But masking, so important. Universal masking indoors, to me, is a no-brainer. It's not putting anything in your body. It is not hurting you. It only helps you. It only helps you. So the COVID-19 cases roaring back across the country. And as time goes on, this is going to continue, because you got so many folks getting misinformation, wrong information, and doing something different. If you live in an area where the infection rates are lower than another area, you still need to wear a mask. You know why? Because folks travel. It's only going to take 1 or 2 folks to come in and turn that whole thing upside down. But because you got folks in one area doing one thing and folks in another area doing something else, and everybody's traveling everywhere, if one city or one state is having a problem, everybody has the potential for a problem. Philly has mandated masks. The new mask mandate announced for the city of Philadelphia. Florida hospitals are overrun as the state fights one of the worst COVID-19 outbreaks in the country. So I'm telling you, it's different places, and Florida's a vacation spot. So folks go to Florida and live all over the country, and then they're going to take that back. We're seeing this in Florida now. This is going to be something that we are going to be dealing with in other states. Proof of vaccination and a negative COVID-19 test needed at some Maryland and DC venues. So we're going into football season. They're going to probably try to roll that out for a lot of folks. And in Maryland, COVID-19, 32 hospitalized, 886 new cases reported in the last 24 hours. the last 24 hours. Also in Maryland, hospitals are concerned with surge of new COVID-19 inpatients. Folks need to wear masks. We have to, indoors. Doctors in Maryland also seeing more kids with COVID-19. This is something that is expanding. The confirmed coronavirus cases in Baltimore County at 67,361. So there's a push in Baltimore County to get more students vaccinated before classes begin. Class is going to begin at the end of the month. And there was a vaccination clinic today in West Baltimore. Baltimore County hosting a mass vaccination yesterday to encourage students to get vaccinated. So there is a big push, but I definitely want folks to understand that the vaccination is not going to prevent you from getting coronavirus or spreading. That's why we still need to couple that with wearing your mask. Very important. Wear your mask. Hashtag mask up. Let me know your thoughts in the comment section. Of course, Instagram, Facebook, Twitter, LinkedIn, TikTok, at The Diamond K Show, at Radio on Fire. You want to support Diamond K in the morning? Very easy to do that. Very easy. I'm able to deliver our news and our views on Diamond K in the morning because of our listeners, sponsors, and of course, your donations. Diamond K in the morning is powered by the people, and we need your support. Visit radioonfire.com to make a one-time donation or something else. Visit the store, radioonfire.com/shop. And social media at The Diamond K Show, at Radio on Fire. I will be back, of course, tomorrow, 8 a.m. or later on today as news